members of PAFI to this session, Reimagining Health and Economy. If the last 18 months have taught us anything, it's the necessity of adequate and sustained investment as well as innovation in our healthcare. And this is true for all economies around the world. Uh, as we celebrate this momentous milestone of 1 billion vaccines today, and it's been sort of top of mind for everybody, and with the Prime Minister's address just an hour earlier, it only reiterates and recognizing the strengthening of India's pharmaceutical healthcare sector. This morning, we heard PM Modi applauding the commitment shown by the administration, researchers, vaccine manufacturers, hospitals, doctors, everyone coming together to collaborate to achieve this success. And technology has truly played a critical role in achieving this mammoth milestone. Our session today is actually going to bring alive the spirit of partnership between government and private enterprise to enable innovation, and this also stands true to the objective of PAFI of enabling engagement and dialogue for informed decision making and creating the right platforms, well as our government. We'll explore the recently launched Health Tech combined with Ayushman Bharat, launched a fortnight ago, and providing an opportunity to reimagine affordable and effective healthcare by leveraging health data of individuals. Is this going to be the UPI moment for healthcare? How will the health stack integrate public and private sectors while also ensuring data privacy and security? Will be some of the questions our panelists will talk about today. Let me start by introducing our panelists. We're very honored to have Dr. Ram Sevak Sharma, CEO, National Health Authority, Ministry of Health and Family Welfare. Dr. Sharma is responsible for managing the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana and the National Digital Health Mission. He also serves as the chairperson of the Empowered Group on Vaccine Administration for COVID-19. In his illustrious career with the government, Dr. Sharma has been leading reforms and leveraging IT to simplify administrative processes. With many achievements, of course, to his credit, some of the most notable has been the role he's played in India's unique identification program, and his book, The Making of Aadhaar, world's largest identity platform, captures this journey. Welcome, Dr. Sharma. It's an honor to have you with us today. Next, I will go on to introduce Dr. Randeep Guleria, Director, AIMS. He is Professor and Head Department of Pulmonary Medicine and Sleep Disorders at the AIMS. Having spent over 2 decades at this institution, he has been pioneering work in respiratory medicine, winning multiple awards and accolades, including the prestigious Padma Shri Award in 2015. We're also delighted to have with us the dynamic Shobna Kaminini, Executive Vice Chairperson of Apollo Hospitals Enterprise Limited and a member of its founding family. She has helped build Apollo Hospitals as a pioneer in private healthcare in India and as Asia's foremost integrated healthcare conglomerate. Championing several initiatives, she now steers the organization's emergence as a proponent of integrated digital first healthcare services in the country. Welcome, Shobna. Wonderful to have you with us. We're also delighted to have Dr. Manjari Bakre, who's the founder and CEO of OncoStem Diagnostics. Dr. Bakre founded OncoStem about a decade back and is focused on developing innovative testing for avoiding overtreatment of patients with chemotherapy drugs, resulting in improved quality of life and savings. Under her leadership, OncoStem has won many awards and is recognized today as a health tech innovator in the country. Welcome, Manjari. Great to have you here. We also have my colleague Nilima Dwivedi, a fellow managing committee member of PAFI, who's also the Senior Director, Public Policy, Corporate Communications and Market Access for MSC Pharmaceuticals. She will be delivering the vote of thanks at the end of this session. And now, without much further ado, I'm going to hand you over to our extremely capable moderator, Anil Padmanabhan, who has over 35 years of experience in journalism and brings to forth his expertise today on narrating stories which really matter to us. And I'm sure he's going to keep our panelists extremely engaged to share their stories and perspectives. Over to you, Anil.
Thank you, Deepshika, and hi everyone. Welcome to all, both on all of my fellow panelists and colleagues, as well as those in the audience. First off, thank you, Puffy, for having me and giving me this opportunity to anchor a discussion, what I believe is a fantastic topic and an equally impressive panel of speakers. I couldn't have asked for anything more. And to set the context, the topic before us is hugely relevant. Uh, Goes without saying, when we often is played down in public discourse. So which is why this kind of a conversation is extremely important. Just to cite two examples, the AIDS epidemic in South Africa, it wiped out nearly half the working age population. And of course, closer to home is the pandemic. And we know the health costs on the economy and the way our economy contracted in the last 1 year. So, needless to say, that idea of health as a risk is very important, and it's great that Pafi is projecting this as a conversation today. And if you look at the whole thing, we have a perfect segue. Like she mentioned right up front that we had this 1 billion vaccine benchmark yesterday, which is, I think, a terrific moment. And just about 2, 3 weeks earlier, you had the National Digital Health Mission, which is launched. So, which we'll go into in more detail. But in short, it enables portability of records, health records, creates a health registry. You combine the NDHM and the 1 billion vaccine mark, and you look at a very interesting context, which is why we asked this question, which leads to our topic today, whether UPI, this is a UPI moment in healthcare. And we all know the kind of achievements that UPI has already logged in a very short span of 5 years. So to discuss this, we have, like was spelled out before us, a great panel. I will not repeat what has already been mentioned. And let us not forget, all of them were part of this front line in this fight against COVID-19. So first of all, grateful to all of you, not only on my behalf, but on behalf of everybody around. Thank you. The format we follow is as follows. I'll request each panelist to go for 5 minutes each. And I'll begin with Mr. Sharma and then move to Dr. Guleria and then Shobana and finally Manjari. And after that, we'll break for about 15 minutes of conversation among us. And meanwhile, we'll open up questions. Just a request, Dr. Guleria has to leave for an urgent meeting at around 12:30. So if there are any questions for him from the audience, please feed them to us and we will ask it of him before he leaves. So and we have a hard stop in about 15 minutes. So we need to respect that. So without much ado, I will hand off to Mr. Sharma.
Well, thank you very much, Mr. Padmanabhan and Deep Shikhaji, Dr. Valeria, all other members of this panel and also people in the audience. Good morning to all of you. I think it's another very interesting discussion which BAFI has organized, and my friend Virat has always been kind of ensuring that I don't miss a session, and thank you, Virat, for that. And I always have enjoyed these discussions and deliberations, and I've always come out, after adding something to my sort of information, knowledge, whatever you say. The question that whether it is an UPI movement for healthcare is a very relevant question, and many people kind of use that as a phrase, and that actually I'm a little scared of that phrase. Why I'm scared? Let me tell you. One of the reasons is that UPI movement, when they say UPI has become such an extremely successful platform and extremely scalable platform that to sort of achieve that, the expectations go really sky high. So anything below that will be a disappointment. And unfortunately or fortunately, I am placed in that position where people will say, "Oh, you are the guy who is implementing the Ayushman Bharat digital mission, and you did not come up to the expectation. So that's a personal kind of reason. The other reason is, I think, a more serious one, is that UPI is actually, in a way, a single dimension stuff. It's a payment space. It's a simple money transfer. It's a peer-to-peer money transfer or money withdrawal or whatever. So it's a single, dimension stuff. Not much is there. There's not much variety in some sense. Health is a completely different element altogether. Completely different stuff altogether. So it actually health involves a large number of stakeholders of varied kinds, so therefore, and varied kinds of services, diseases, protocols, and therefore it is really, bringing it all there on a digital platform and seamlessly interacting and working is not similar to just transferring money from person A to person B in a straight manner. So that way, this is a much more complicated stuff. Thirdly, you see, let us also understand that the number of stakeholders in the UPI is, there are largely three stakeholders. One is the payment service providers. Another are the banks. Another is the central, clearing house, which we call NPCI. And then, of course, you have the customers. That's the overall stuff. In health provisioning, there are large number of hundreds of thousands of stakeholders, starting from small clinics to large hospitals to technology savvy hospitals, to technology, sort of not really doing anything about technology. Then, of course, you have the pharmacies, you have the laboratories, diagnostic labs. You have all kinds of, all variety. It's a very diverse ecosystem. And unless you bring the ecosystem on a single kind of thinking and platform, which is so difficult, then, unless that happens, it will not become the UPI of the health services. So there are multiple challenges. They are at a different stage of digitization, for example. And that, I think, when you say digital mission, uh, uh, one assumes that there will be digitization of the health space, which is far from away. And then you are dealing with human beings. Please understand, this is not just dealing with a technology where you say, I want to transfer 500 rupees and it's done. You are dealing with doctors who may not like to write, or, I mean, if you want a doctor to type, I don't think any Dr. Guleria will agree with me that typing is not really the way doctor must be spending his or her time. He or she should be just diagnosing person and giving instructions and getting things done, rather than, so data entry, so long as data entry remains a separate activity rather than a natural consequence of the activity itself, this whole digitization business is not going to take place, and we have to think as to how this can be done. So I think there are many, complications in this issue, but I also want to say that there are very, very huge transformational returns from this project if we can do it. It will really provide a ubiquitous, accessible, affordable, quality healthcare. I can assure you, because there are large number of areas in which the costs will significantly reduce using technology, and that significant reduction in cost will obviously be passed on to the service providers as also to the people, customers, or the patients. So I think this can transform the landscape. Only thing is, for that transformation to happen, the entire country will have to come together, and there are examples of the entire country coming together. Look at COVID, vaccination program. Our vaccination program, we really, the entire country came together, the doctors, the nurses, the vaccinators, everybody. And once that happens, India can create magic. We have created magic, and we have created lots and lots of digital public goods. Actually, in digital space, we have done wonderful work. We have done Aadhaar, we have done UPI, we have done other kinds of payment gateways. So there's no reason why we cannot do the health stack. We shall do health stack, provided everybody comes together. And of course, everybody is convinced of the thing. It should be win-win-win for everybody. Somebody should not feel that, I will be left out. So these, I think, are the broad, sort of uh, uh, things which I wanted to, caveats, if I may use that term, wanted to put before you to really have a realistic appreciation of the complexities involved, and also how how much relevant is this comparison with UPI. Thank you very much.
Thank you, Mr. Sharma. Thank you for that very candid assessment of what is a potential game changer. And I like the way you signed off with the 1 billion, which is a yes, we can moment. So it is a moment where India can believe in itself. Dr. Guleria, over to you.
Thank you very much. And I'd like to really start by thanking Pafi for inviting me to this discussion. And it's really a pleasure to be with such esteemed guests and panelists. Now, I'd also like to congratulate everyone on our 1 billion mark that we've achieved. It's a huge achievement, and I think we should all be proud of that. But what the pandemic has done, it has shown two or three things, I think. One is health has become the center stage. The importance of health has been realized like never before. Before COVID-19, health was never given that much of importance, although we did talk about health. But the pandemic showed that if you don't have a healthy nation, you will have effect on your economy, it will affect tourism, it will affect travel, and it will have a lot of effects which are so-called collateral damage. That was the first thing that I think it did show. The second thing it showed was that if we all get together, come out of our silos, we can do a lot of things. As Dr. Sharma mentioned, we can do magic, if I use his words, because this is actually what happened. People came out from their silos and started collaborating. It's not only with the vaccine, even before that, whether it was making PPEs, whether it was making N95 masks, or trying to make ventilators. People from different sectors actually came together, and that showed that there is a huge strength that lies in our country, which is not used because we are working in silos and we need to start working together as a team. So that is the second important thing. The third thing, which I'd like to also elaborate on, is it showed the importance of technology in health. It really showed that technology, if used properly, can be a game changer in our country, where there is this big issue of the resources and manpower crunch as far as health sector is concerned. So we adopted very quickly teleconsultation, which allowed us to consult with a large number of patients across the country without them having to come to the hospital. It was cost effective, it was safe from the infection point of view, and that is something which really showed us the power of being able to use technology, not only to consult patients, but have data being transferred. You could see their ECGs, their X-rays, a lot of data could move, and that allowed a consultation which could be done. Our dermatologist actually said that they're finding this very useful. They asked the patient to send the picture of the lesion in the skin, and they can diagnose it and then send it back. And they could really do a lot of teleconsultations, which helped them in terms of decreasing the crowd in the OPD. It showed the strength of managing patients remotely, the eICU platforms. You could have doctors who were specialists who were far off, and they could advise primary care physicians how to manage patients, because again, the data was something that could easily be transferred from one area to the other. And you could see the ventilatory data, you could see the treatment chart, you could see the monitors, and that gave you an idea of how the patient was doing and what interventions required. It also had a huge effect as far as education was concerned. Again, we were able to reach out to a large number of people like never before. It actually, in our sector, it changed how conferences were going to be held. Conferences, when you are holding, you can call limited number of international faculty because you have to pay for their travel, their stay, and a lot of other things. I've noticed over the last few months, all conferences, you have now a huge number of international faculty because they're willing to come online. And it saves you a lot of, let's say, funding resources that you would have otherwise spent in the travel, accommodation, and other things. So it allows us to really have a huge audience and be able to discuss things using technology where we were not able to do this. And this has helped us to develop simulation models and things like that, which are also very useful in training healthcare workers. But I feel that this alone will not work. And technology has to really accept that the health sector is different. And we have to adapt and change technology to the needs of the health sector and then the needs of the doctors and patients from different parts of the country. So we have to, in my mind, look at how can we add it on to existing framework. We can't change the entire health system and tell everyone to take on technology. As was again mentioned, it will not work. If I ask all the doctors that in the OPD you start typing the data of the patient, or you start recording the data of the patient, they would say, especially in a government sector OPD, which is very crowded, you spend less than 5 minutes a patient. You will need another 5 minutes to type the patient's history and the records. And similarly, a lot of other information will get lost. So I think what we need to really look at is that we also have a large workforce. The population in our country is large. We have a large workforce of partially skilled people. Can we use that workforce as an add-on to technology in the health sector? And that will really help in really building up a health sector which would be very useful. So there could be assistance to the doctors, to the nurses, to various sectors as partially skilled people who can enter the data, help in solving issues. For example, if you're having a teleconsultation, you could have a call center which could be actually directing patients whom they should consult, and that would really help a lot rather than the doctor deciding that no, your problem is more related to ENT. You need to go to the ENT specialist and not to no, you don't need to come to me. So something like that. Also, I think we should look at and address health inequity. That is still there in our country. We have a huge inequity as far as health is concerned, both in urban and rural India, and that has to be addressed. And I sometimes worry that we should make sure that technology doesn't increase that divide. We must make sure that it is more inclusive of even those who may not be that tech savvy. And that is very important in the health sector. I also think we should address a lot and use technology for preventive and promotive health. The money investment is going to be the maximum there because we are going to see a huge burden of non-communicable diseases. India is known as the diabetic capital of the world. But if you go to rural India, majority of people have never got their blood sugar checked. They never got their blood pressure checked. They don't know whether they have hypertension. They come only when they've had a stroke or they've had acute myocardial infarction, acute heart attack. So there has to be a lot of focus on using technology, and that is available. We have now technology which can monitor all of this digitally, remotely, and that is something that we need to do in terms of screening for non-communicable diseases, screening for cancers, which will help in the burden of disease in a big way. And then, of course, looking at other mechanisms like sanitation, decreasing air pollution, because they also have an indirect effect on health. And finally, I think one other important area that we need to really invest in, and this also the pandemic has shown us, is research, and research which is translational. Because it was research which really brought on to the vaccine, Indian-based research which got us an Indian vaccine, research which helped us to develop PPEs and look at ventilators. So we have to invest more in research which is India specific and encourage more entrepreneurship. Why can't researchers and scientists become entrepreneurs and take things to the next level? So this liaison of scientists and researchers with industry also needs to be developed in a inclusive manner so that we have more entrepreneurs, and a lot of products which could be developed in India are taken to the final stage and they usually come into the market. Therefore, I feel that if we have a well-structured plan with public-private partnership, which is adequately financed, then we can use this opportunity to change the health sector. This can be a defining moment for us as the health sector was changed 75 years ago after the Second World War in large parts of Europe and America. The NHS came out as a result of the Second World War. So I think if we look at it from that point of view, this is a moment that we could really change health in our country for the better, but it has to be inclusive and it should really address all so that there is no inequity. Thank you very much.
Thank you, Dr. Valeria. Thank you so much for again taking the cue from Mr. Sharma and laying out a very candid and doable map ahead of us for the health fabric. Now, Shobna, can you go next, please?
Yeah. Good morning to everyone. I just want to say that uh, I I really believe in this after COVID and everything all of us have been through as a world, as a country, that nothing can stop an idea whose time has come, or a mission that is driven by the purpose that I've seen actually in some of the things that India has transformed in the last 2 to 3 years, be it Ayushman Bharat. Nobody could ever believe that 500 that 500 million people would have access to healthcare at the price point which is unheard of anywhere in the world. So I think that first step, and then the evolution of what went behind. Of course, it required so much behind it to be able to take that step. You can never take such a bold leap if we did not have the Aadhaar, if we didn't have the connectivity, if we didn't have this the UPI. All these are required, so the framework is there. So I have great belief that the NDHM will be transformative. I'm so happy that such a practical person like Dr. Sharma was there, and he really put it so candidly that Dr. Sharma, you said that healthcare is complex. I use UPI every day. I think it changed my life and made it easy, and like it's done for billions of transactions that take place. But health is unstructured, and like you said, it's differential service delivery. There's so many people who need to who need to be able to deliver this care, and none of us are on the same platform. Even care protocols are different wherever you go, and I think that's so important. Most important is that unlike banks or financial transactions, it's not mandatory for it to be recorded. And I think that's where, a real UPI would take flight, is when things have to be recorded. And when that transparency has to come, then you can create some amount of standards and uniformity behind it. So which is why I believe that the NDHM, when it talks about safety, interoperability, security, and reliability as core pillars, it stands a chance, of this national health stack. I truly believe that as a healthcare player, if we don't have this, India will not be, we'll hit a wall. We'll hit a wall of inadequate resources. We'll hit a wall of not being able to give better care, or like Dr. Valeria said, the NCDs will overwhelm us because we won't be able to have enough facilities. We won't be able to give preventive care. So I think that this, to me, the NDHM is really it has to be such an important mission that everybody understands. So right now, from a healthcare perspective, we've been working very early. Apollo is one of the early adopters that have been working with the government because we believe that it's transformative. But there are a lot of people and a lot of healthcare players that say, oh my God, what will happen to the data? Patients that say, what will happen to my data? Is it safe? What's going to happen? So I think that before we really move into it, and that's why I like this discussion. We need to have a series of discussions that actually talk about how it's going to be transformative. And I think that once that happens, that people start accepting that this is not threatening, that actually this is something that's necessary to make your life easy. And UPI went through the same journey. So I think this is important, that we are in the first step of creating believers. And when we do that, then the opportunities, and then it starts evolving. And I do believe that the way the infrastructure is being written up, this is a movement just like cell phones, just like anything else. It's slowly, then suddenly. So I feel 2 to 3 years from now, if the same conference was there, we would all be talking about the outcomes, how many things that it's really transformed, where we are in those kind of statistics, rather than us saying that that here it is, we're starting. But everything has to start at one point, and I just want to tell you, from a private healthcare player, we truly believe that this is necessary. I have another hat. During the pandemic, we actually I'm part of a foundation called the SWAST Digital Health Mission. And what they did is that, recently it was launched that we tried to work to standardize, because there's so many different codes for the health insured and the interoperability. So you had the TPAs, you had the health insurers, and all the claims processing. So in the national health tech stack, what we could do is to actually try and make the process so much easier, so that within minutes, when a patient gets to a hospital, you can immediately see it doesn't matter which healthcare facility, it doesn't matter which provider, I mean which insurer you're with, but you should be able to see that here I can accept this patient. And these are the kind of things that are going to make it easy. So it's a live use case that I'm talking about, and this is something that a non-profit. So I think that there's a lot of opportunity for the right spaces to come. And with that, I want to move into the last thing that I want to talk about, is that I do believe that while the opportunity is there in India, we're almost in the stage of like the San Francisco gold rush, or when that Y2K, things are so crazy that you have crazy money being thrown after the craziest of projects with this. So there'll be many entrepreneurs that come up and they'll do stuff. But unless we can have those guardrails, and I believe that if the National Health Mission doesn't put those guardrails up, we're going to really cruise into some spooky territory of things that will be detrimental to health. And to me, if you ask me, that would be the worst thing that could happen to our country's health. Not just the inadequacy of getting help, but doing it the wrong way. So we have to respect doctors. You have to say that a prescription cannot be generated by an e-commerce player. For just as an example, it needs a doctor behind that. I mean, this is the way. This is the trust. So that whole chain of trust has to be there, and the guardrails of how we do transactions. And I think UPI did it well, that they put those guardrails in place, and that was the success of it. The UHID will do it well. I mean, has done it well, of stopping fraudulent, that you need to have an identification. So this is where I would actually like to stop and say that huge amount of belief and relief that we have something like this happening. And I do think it's hugely transformative. And I'll end on the best note, that saying that I'm proud that, to be part of that effort that did the 100 crore vaccinations. The private sector played a small role because the government really stepped up, and whatever we can do, we'll continue to do what will keep India safe and which will bring us back to a new normal. Thank you.
Thank you, Shobna. Thank you for also flagging the importance of introducing guardrails while we develop this new architecture. We'll come back to that in our conversation. Now, last but not the least, Manjari, can you leave your address, please?
Yes. First of all, thank you, PAFI, and all the organizers, Mr. Ajay Khanna included, for having me on this panel. It has been an absolute honor, and it's a very well organized panel, has been alluded earlier. So, as an entrepreneur, I think I have a very different and unique background amongst the panelists here. Entrepreneurs in general have a ringside view of things, because what is offered by the government, what is offered by public players, because we are, as entrepreneurs, we are always trying to fit our products to see where is the need, where we can utilize our product in the entire healthcare ecosystem. So that and additionally, having volunteered with iSpirit, I'm absolutely aware of the umbrella project of Health Stack, which is now called UHI, and the entire digital mission, and the amount of hard work Sharat Sharma and the team has put in to really make this happen today. It is absolutely unique, and it will really play a huge and critical role in building healthcare infrastructure in India. And I'm absolutely positive, Dr. Sharma, that it will be a huge game changer for our country. It is absolutely the UPI moment for our country. Now, if I think through this deeply, taking a leaf from what the US has done and how public infrastructure can be utilized for greater good. I mean, when the US has developed the entire GPS via use of satellites, etc., Google and private player at that time, a startup got in and really made use that infrastructure that was developed of GPS and developed Google Maps, Google Earth, and many such technologies. So especially in a country like ours, where our R&D budget is small and 0.7% of our GDP compared to any US or Israel, which is about 3 to 4%, we need infrastructures like this ABDM, which have a infrastructure, public infrastructure ready, and now we really cash it by developing additional building on that by use of the extensive technology that has been developed for uh, opportunistic manner for different aspects of the healthcare that we really need to build to be able to help every patient, whether the patient is in a small town in northeast or in Mumbai. They should be able to help in an emergency situation or in a normal situation for whatever issue that they are solving. And I think as an entrepreneur, I see huge benefit of this in terms of what ABDM is creating. They're creating huge registries for doctors or providers for services. They will also create healthcare, longitudinal healthcare records, and that will go a long way in really helping the entrepreneur to analyze data, to analyze annotated and anonymized data, to create more innovative products, where to create really build it. And for entrepreneur, what is important is, yes, I have built a fantastic product, but now I want to see where to fit it into the infrastructure. Now that we don't need to worry if there is an infrastructure already. If an entrepreneur knows that, yes, this kind of a software telemedicine infrastructure will go into this unit of NDHM. They just need to make it NDHM compliant, NDHM ready, to be able to utilize this fantastic infrastructure we have put in. So entrepreneurs can really focus on developing additional products, developing additional ways and means to really cater to the healthcare delivery aspect and make it very, very useful. So this is where I think we can go in a long way. For another example, I would like to put in also is an insurance claim. I mean, currently the insurance claim process takes 800 to 1,000 rupees to claim one claim, to process one claim, and it takes few hours. I mean, so this needs to be really brought down, and this is exactly why we have only inpatient claims. But to get it to outpatient claims, what we need is, what will help is this ABDM like infrastructure, where the data that will reduce the frauds, that will create a standardized process in which data is accumulated, shown to the provider, and it will take few seconds and few rupees to really process a claim. So this is the power that NDHM and ABDM will provide us, and I really look forward to the future with great enthusiasm to develop additional products and care to really help us really cash on what we have developed and really make it utilized for the public greater good, to really make a very healthy India as a country.
Thank you, Manjari, and thank you for the fact that innovators are going to be very key in this framework. Like Mr. Sharma said right up front, we need all stakeholders on this page. Dr. Guleria has to leave, but before you leave, Dr. Guleria, can you just help me set the context of my first question, which basically picked up from where you left off, saying that there should be a right tension between technology and the human part of the entire healthcare. So could you just flesh it out a little more? Because I think that's the point which I'd like Mr. Sharma to address, as to how do you manage this tension at the right level so that it doesn't keel over any one way. Thank you. And thank you for being on the panel.
Thank you. I'll try and stay for as long as I can. But I think the health sector is a very different sector as compared to other sectors. It has a lot of players, both in the private and the public sector, and it has a lot of diversity. You could have a small clinic, you could have a nursing home, and you could have a tertiary care state-of-the-art hospital. Now we have to try and integrate all of that. there's also an issue of inequities which exist in the health sector, and the fact that there are places where you have doctors who are already overburdened, and technology should be user friendly rather than increasing that burden. I'll give you an example that there are, for example, there are doctors in the US who are saying that they are not happy with the technology because they get paid by the data they enter. So they work in the day and see patients, and they spend the evenings from almost 7 to 10 in the night entering the data of the patient that they've seen, because the insurance company will only reimburse them the money if the data has been entered. And therefore, they spend the whole time really trying to get that data on board, because that's the only way they can get paid for the patient that they've seen. So we need to try and find a way that it is user friendly, and also that it doesn't increase the inequity, that those who are left out or are not on that platform don't feel that now because of this they're not able to access healthcare the way they would like to do. So I think that that is the point that I was really trying to make, because like I said, healthcare is a diverse sector. It's not that simple or easy as banking would be, because there are too many players in this, and then you have other things coming in from the point of view of research, from the point of view of training and academics, and then patient care. So we need to really try and see how we can integrate everything, and technology is going to be the key, but how to use it properly is going to be the challenge.
Mr. Sharma, could you kind of address this concern? You did flag it in your opening address, telling us very clearly that this is not a linear uh, system that we are looking at, and it's extremely complex. But if you could respond to it.
Very much, and I think Dr. Valeria has really articulated it so well. Uh, this whole complex nature of the intersection of technology and the diverse kind of players in the health system. So let me say let me deal with that question first. One, I completely agree that the technology has to be inclusive. It has to cater to diversity as it exists in the sector. It has to be interoperable. It has to be scalable. It has to be frugal. It has to be kind of, people should find it very easy to use it. So it should be easy to kind of integrate in our workflow. It should not be an activity in itself. Catering to technological requirement should not really become an additional burden on the time of a doctor or a health professional. So I completely agree with his analysis, and I think he has said it very well, that look, this is the way it is going to. So basically, we have to now start from that hypothesis as to the design of the technology. So let me just give you one example. Of course, it will be like boasting yourself or boasting about the whole thing. COVID is an example. Now, when we were given this COVID mandate by the Honorable Prime Minister in the initial month of January, and we sat down together, me and my team, then we said, look, how do we design this? So, some guys were saying, oh, let's have a username and password for every fellow. Everybody should be able to go and a username password. मैंने कहा कितने लोग username password याद रखेंगे यार? So basically, I said the best username is your mobile phone number, and the best password is OTP, and it is very safe. And having been in the Telecom Regulatory Authority of India, I was aware that spoofing the OTP is a very difficult process. Of course, one can do it, but so therefore, this is the easiest way. So then, and they let the mobile be the basic, and once the fellow enters, he just looks at his dashboard. He's not bothered about other things. Ki kaun sa statistics ho raha hai. So essentially, the technology became people centric. Technology must become the health professional centric. That should be the overarching goal of the technology, and I think we can design it. Believe me, we can design it. Today, COVID is integrated with more than 100 applications. You know that Paytm, Infosys, Max, Go Ibibo, Make My Trip. Everybody is providing services for hospital vaccination center, search, and also booking. Now that is because we used open APIs. So basically there are tools available which like internet. I mean, think of internet. Internet is connecting 7 billion devices. How is it connecting? I mean, I've got an iOS, you may have a Windows, somebody has a Linux, somebody has some other things, Android. It is connecting because there is a very clear protocol for connecting. There's a clear, so basically we are not going to build an Amazon, a siloed e-commerce platform. It's not, health is certainly not e-commerce platform. It's not, it doesn't even have analogies of that. But what we are going to build is an open network, which could be able to connect disparate systems. So you may be using one HMIS, I could be using another HIMIS, and then still we should be able to talk. So minimal kind of thing. However, what is important is for us to understand what advantage this country has got, why we can do it, why others cannot do it. I just want to, and this is not just a story I'm trying to tell, but this is a fact. See, trust in a digital world is so important. A doctor must know that this is the patient I'm talking to, and the patient must know that this is the doctor I'm talking to. Now, in a digital world, if you have a robust digital identity, that is the first requirement to have a very meaningful, trustworthy transaction, especially when you will have patients who are not known to doctors, and obviously this is going to happen. So one is a digital trust, and we have created a digital identity called Aadhaar, which actually can become a very, very robust way of identification and authentication. Two, payments. You have to pay to the doctor. If you are doing a consultation, you have to pay to the doctor. You can't pay to a doctor in cash when you are doing a consultation on telemedicine. You have UPI. Then the doctor has to write a prescription. Now he can't write a prescription and then scan it and send it over to the patient. There is an e-sign. There is a digital signature on demand which is available because of your digital identity. So you can e-sign. Then I can't share the data to a doctor without giving a digital consent. Now we have a digital consent artifact. In fact, the Western countries are now, European countries are now grappling with implementing the GDPR, the General Data Protection Regulations, because they don't have a consent artifact, a digital token which I can give it to you and say, look, this is me and I am giving consent to share my data with you. We have a digital consent artifact. So we can give that to basically, and e-sign will enable the digital signatures on the prescription, will enable people to deliver and dispense drugs even if they are not on the counter. So we have all the tools. We now have e-rupee, which is actually a person specific and purpose specific digital instrument. So we have created these digital public goods over the last decade, which actually become complete enablers of conducting these kinds of transactions on internet, transaction in a digital manner. And that is a prerequisite for any meaningful and successful thing to happen. On top of these horizontal utilities which I described, digital locker, e-sign, Aadhaar, UPI, and consent artifact, all kinds of this thing. Then on that we are going to build the registries, which are the reference document, reference files, which is registry of doctors, health professionals, registry of hospitals, registry of drugs, all these kinds of registries. This will basically provide a ready-made, kind of repository of all the service providers in this sector, whether it is laboratories, diagnostic labs, X-ray, I mean, all kinds of stuff, the pharmacists, etc. And on top of that, we will have a set of applications, and which I think Shobhana ji was talking about, the entrepreneurs and the startups, they are really waiting. And then the beauty of this system will be, currently all the providers will have to cater to everything. 1mg and Practo, they have to first of all figure out the service providers. Then they have to provide the drug pharmacies. Then they have to find out the doctors who will write prescriptions. They are doing everything. And then they have to find out the customers for downloading their applications and basically start using their applications. So they are vertical silos. They are catering to everything. Now, startups of tomorrow, after this whole thing has come in place, they don't have to bother about because they have access to the entire set of doctors in the country. They have access to entire set of hospitals in the country, entire set of drugs in the country, entire set of labs in the country. They just have to build applications. And this is the beauty of an open platform where you can build application. This is the beauty of internet. Internet is a permissionless platform. I don't know whether you guys remember the debate of net neutrality. Net neutrality debate in which Mark Zuckerberg was saying that, I'll provide digital freedom to the people of this country. And everybody was, people just, there was a huge fight on that. And we said, no, net neutrality is important for a country like India, who is going from completely offline to a completely online system. We can't, my innovators cannot run around the telecom service providers to provide them the passage, because net neutrality, basically, if it is not there, then this makes these gatekeepers, who are the TSPs, the telecom service providers, as the guys who are controlling the access to the internet. That cannot be allowed. So therefore, these things are, first, we have the necessary artifacts, digital public goods. Then we have the, these open networks which we are creating. This will ensure, this is a protocol based network. This will ensure that anybody who is whatever little solution I've got, I can plug in that solution. If I have a solution for, let's say, giving better diagnostic, I can plug in that solution, and that solution has the entire market available with me. It's not that if I have to give some commission to Amazon to become a seller on their platform. It's not like that. And it will be a completely non-discretionary platform. The search will be neutral. There will be no sponsored searches. So a person can book, search, take appointment, do transactions, pay, get out. This is the way it is going to work. And hopefully we can make it, obviously we can make it work only when everybody comes together. Everybody realizes that there is incentive for everybody in this game. If I take out the incentives for any player, that player will definitely not come. So we need to devise appropriate incentives, appropriate incentive alignment has to be done to make this process happen. I hope I answered Valeria's questions and also some additional ones.
Yeah, you answered some questions in anticipation also. So, but I just want to, while we are on this architecture, Shobna had mentioned a very important point on the guardrails. I just want to add to that. One serious concern on the guardrail is privacy. She had alluded to it in passing. So do you think that the privacy challenge, because I know there is a legislation in the works and you did mention it briefly on the structure of it. So do you think that legislation will come in time, or that lack of that could threaten and derail this entire UPI movement in health?
I think that's a very important question, and people do have a lot of confusions also about it. So let me remove some of that confusion. Aadhaar, we did Aadhaar in 2009, and the privacy was not really such a fashionable word at that point in time, and it was not even a fundamental right as declared till that point in time. It was declared in 2017. So what happened was, we followed certain principles, and these principles are what is called privacy by design. You design privacy. People think that designing for privacy will reduce functionality. And therefore, they think that privacy is a zero-sum game, that if I make things private, then I can't do anything. But that is not the case. If you design carefully, it is a non-zero-sum game. You can continue to have all the functionalities without sacrificing privacy. And that is what we had designed Aadhaar with. And so therefore, some construction of 2009 passed the touchstone of privacy in 2018 by the Honorable Supreme Court, 5-judge bench of Honorable Supreme Court. And privacy by that time had become fundamental right. Now, it happened only because we were very careful in designing. And some of the principles of privacy are: 1, minimal information; 2, consent-based, sharing of information; 3, purpose-specific information. Don't use it for the purpose other than what you have collected it for. Notice. inform the guy if his information, even with his consent, is being used. So there are 7, 8, 9 principles which we had followed. These are exactly same principles we are following in the National Digital Health Mission, or what is called Ayushman Bharat Digital Mission, number one. Number two, another privacy preserving principle is federated data architecture, which means I am not going to put any data which I don't require to put, which means let the data remain wherever it remains today. Only thing is that data become accessible through digital means at the instruction of the data owner, which is the patient. So if the guy has had interaction in Apollo, his data will remain in Apollo. Only when he goes to Max Hospital and he wants the data to fetch from Apollo, that data should be real time, it should become visible on his device. But the data must not travel. This is another principle. So basically this platform or network, whatever you are calling it, is not going to store any data except the data, the reference data, the data of the hospitals, data of the doctors, data of the labs, and other kinds of things. So therefore, we are not undertaking, we are not becoming a super, holder of all kinds of data to basically become responsible for that. Aadhaar, for example, Aadhaar does not hold any transaction data. Aadhaar even does not know for what purpose you are using Aadhaar. It only knows is that you are using Aadhaar, and it basically tells you that, look, your Aadhaar is being used. If you are not using Aadhaar, like banks say that, some money has been taken from your debit card, but if you have not done it, please inform us. So that is, if you do Aadhaar authentication, and an email comes to you, an SMS comes to you immediately, this is how it is going to happen. So we will play the role of an, kind of somebody who is just having this kind of data. Then of course, consent manager. This is, people ask me, why are you giving these identities, health identities, and therefore you are giving identities to me without my permission. अब भाई मैंने आपको एक आइडेंटिटी नंबर दे दिया, आपकी परमिशन के बिना, तो मैंने कौन सा कानून ब्रेक कर दिया, जरा मुझे बता दीजिए पहले आप। मैंने एक नंबर दे दिया, आप यूज कीजिए मत कीजिए, आपकी इच्छा के ऊपर है। अगर आप यूज नहीं कीजिएगा, दैट नंबर इज एज यूजलेस। गॉड हैज फॉर्चुनेटली गिवन इनफाइनाइट नंबर्स, so I can keep on giving numbers to everybody and still the numbers will be there. I mean, this is just a joke, but what I'm saying is that people sometimes don't understand even privacy basically means, in a sense, using my data without my permission. That's what is the violation of privacy. So basically what we are saying is, we just give a number. This number is essentially a reference number to link all your health records with you, number one. Number two, to establish your identity, because this number will be linked to some other identity document like Aadhaar or like driving license or voter ID card, etc. So that's what, just a number. And this number will be used in these transactions. And we are not going to kind of say this is the kind of profiling or anything, because we will not have any data relating to that. That is the purpose in life of this number is essentially to provide a reference to link your health record, so that you have visibility into your horizontal health records. So these are some of the basic principles which we are designing, and we are very cognizant of this fact. Fortunately, we have now experience of designing such systems which have been, which have come out as winner into any legal battles related to privacy, and we are very cognizant that privacy is a fundamental right, and we have to ensure that whatever data we hold, that data is held absolutely in security, and also we preserve the privacy.
Thank you, Mr. Sharma. I had a couple of questions, but we are on the hard stop moment. So I will hand off to Nilima. Before that, I just wanted to say that the big takeaway from today is that we are at a point of inflection, and the National Digital Health Mission is giving us a fantastic opportunity, which everybody in the panel agreed to. And like Mr. Sharma, who's the architect of this entire project, laced it with an enormous dose of candidness. We are and of course optimism too. He just told us that it is doable. And thank you again, Pafi, and over to Nilima.
Thank you, Anil. And so yesterday, of course, India has achieved 1 billion jab, and that is a big milestone which we have achieved. So on behalf of PAFI, I would like to congratulate everyone who has been involved in making this happen. This is really a proud moment for all of us as an Indian. And now I would like to just thank all our esteemed panelists for putting their visions, thought so aptly together. Uh, Dr. Sharma talked about ABPMJY, and we all know that Ayushman Bharat PMJY has just completed its 3 years, right? And we all know about Ayushman Bharat, one of the largest government-funded universal health coverage program of the world, right? And we are really proud of that. And especially the fantastic program where we talked about the public-private partnership opportunity. The amount of opportunity it provides to the private player, right, is simply huge. So huge opportunity, whether it is empanelment of hospitals at providing last mile delivery. I think this is simply fantastic, a great program. In addition to that, Dr. Sharma talked about Ayushman Bharat Digital Health Mission, NDNHM. And NDHM again, and developing health stack. I think that is the need of the hour, and we are so excited to see, and especially having working in healthcare sector, I think we all are really looking at it. Whether it is a patient registry, whether it is the health record of the patient, uh, the entire migration plan which he talked about, I think these are so exciting. So we are really looking for these things to really seeing light of the day. I know many things have already happened and in the pipeline. So Dr. Sharma, thank you very much to you and to your entire team at NDNHM and National Health Authority for making this happen. And and you talked about people centricity and technology, which should be really simple to use and should be people centric. Yes, we are really looking for such technologies, especially for our patient. And also, somebody talked about the insurance claim, how we can see that someday there is a paperless, rather presenceless kind of services, cashless services are being provided, and that's basically is the unmet medical need at this point of time. So thank you very much for that. My special thanks to Dr. Valeria, who really highlighted about the equitable access, building capability of our healthcare workers, right? And technology, again, simple technology, importance of technology, especially in healthcare. And he also touched upon working on silos versus now what COVID has taught us is the collaboration, working together, and industry and institution partnership. My sincere thanks to Shobna and Manjari for their valuable insights and sharing their perspective that how we can really leverage precision medicine, precision technology, data privacy in healthcare. I think these are so important which are topics which have been touched upon. And especially in cancer care, what I see, there is a huge gap, especially in the registry part. So I'm sure now with the help of technology, these things will be taken care, and that's so important. My special thanks to Anil for his wonderful moderation and bringing out such a thought-provoking discussion on such an important topic. And finally, my big thanks to my friend Deepshika for her opening remarks, for her welcome address. And with this, we end this session. But before we go, I would like to urge all our delegates that our next session is at 1:15, and that's a very, very interesting session on stage. So please stay tuned. Thank you, everybody. Thank you. Thank you, Pafi, for this opportunity.
Thank you very much. Thank you.
Thank you for having us.